Community pharmacists are essential partners in Asthma Right Care as short-acting β₂-agonist guardians, inhaler trainers, adherence supporters and educators. Asthma is common, treatable and manageable. Yet many patients remain undiagnosed or poorly controlled, and deaths from exacerbations still occur, even in high-income countries. Because of their accessibility and expertise, pharmacists are well placed to play a decisive role in asthma management alongside primary care teams. Opportunities often arise at first contact. Be alert to persistent cough, wheeze, breathlessness, or frequent requests for cough syrups and relievers. Over-reliance on short-acting beta-agonists is a red flag. These encounters are critical opportunities to identify possible asthma and refer for diagnosis, rather than simply dispensing. Some patients doubt their diagnosis because they don't wheeze. Pharmacists can explain that asthma has several different phenotypes, including cough variant and exercise-induced, and encourage medical review when symptoms suggest asthma, despite misconceptions. See our breath on personalised asthma care for a review of phenotypes. Asthma care is more than medicines. Pharmacists should reinforce non-drug strategies at every encounter, such as trigger avoidance, smoking cessation, occupational risk reduction, and reviewing medicines that may worsen asthma, such as non-steroidal anti-inflammatory drugs and beta blockers. Once a diagnosis is confirmed, correct inhaler technique becomes a priority. Up to 80% of patients make at least one critical error. Pharmacists should provide device-specific training, regular inhaler technique checks, and introduction of spacers when needed, as each is essential to achieving control. See our breath on inhaler technique for a refresher. Pharmacists are also guardians against inappropriate reliever use. Excessive reliance on short-acting beta-2-agonists signals poor control, increased risk of exacerbations, and accelerates long-term lung function decline. Tools such as the asthma control test, reliever reliance test, or asthma slide rule can support conversations about stepping up treatment or referring back to the primary care doctor. See our breath on asthma control for guidance on recognizing poor control. Supporting adherence to anti-inflammatory treatment is another key role. Many patients stop inhaled corticosteroids when they feel well, exposing themselves to relapse. Pharmacists can address misconceptions and stress the importance of long-term control of airway inflammation and highlight medicines that may worsen asthma. In summary, community pharmacists play a crucial role in Asthma Right Care by identifying possible asthma and referring appropriately, monitoring control with validated tools like the asthma control test, the slide rule, and the reliever reliance test, guarding against short-acting beta-agonist overuse, ensuring correct inhaler technique and adherence, and reinforcing non-pharmacological measures. By acting on these key points, pharmacists can reduce risk, improve asthma control, and support patients in achieving a better quality of life. For a deeper dive into real-world examples, read the full case study for pharmacists that this session is based on. Now, time to solve a short quiz to reinforce your learning. A set of selected IPCRG resources will be available for you at the end of this breath.